educate women.
All right, Dr. Jane, if you could tell me a little bit about the machine.
Okay, so this is the laser. It's very petite, not a big deal. And it has two hand pieces. One hand piece is the internal hand piece, and I'm just going to show you what it looks like. It's inside the pack. So this is a disposable. I use disposables on everybody. Everybody gets their own.
Okay.
I don't wash instruments or anything. It's yours. I do wash it once I'm finished with it, but this is a disposable. It's for you. I do not use it between patients. Okay, everybody gets their own. So this is the internal, and I know it may look a little bit big for some people, but it's not, and it doesn't go all the way inside. It's just like the speculum that goes in. It only goes to your area as well as your inside tolerates it. Your vaginal area tolerates it. And once we get to a certain level, we stop, and then it's connected to this, and this is the arm, and it's just a swivel. Mm-hmm. So basically, I move around in the area. For those, some people come to me who have not maybe had intercourse for a year or two. I do a totally different procedure on that person versus somebody who is sexually active. They tolerate the handpiece a little bit different, and I do it totally different. Believe me, we get through it. I have had a lot of patients that have not had intercourse for years, and they are now, enjoying, intercourse again after this treatment. So we get it done.
Okay.
And I work with them, and like I said, everybody's different. Mm-hmm. So that's the internal handpiece. And then this is the external handpiece, because I do get people who come to me and say, well, especially the young people, they're not really that concerned about the internal, but they're more concerned about the external and how it looks.
Okay.
Because the area looks different, it looks darker. The external, I treat with a different handpiece, and this is also disposable. Everybody gets their own handpiece, internal and external.
Now, is that something that helps to lighten up the outer part?
Yes, it lightens the outer part, and it also treats the labia. And the labia I describe is basically the lips.
Right.
And they get elongated, and they just don't look the same, especially after you have children.
Right.
So, I mean, most of us are not really looking down there, but
right.
Sometimes I guarantee you, if you take a look and you look at, you say, wow, it didn't look like that before, and
right.
now it looks different. Well, the laser will tighten the labia. Some people have very long labia. Now, that may require surgery, but the laser will tighten that area too, just like it creates collagen and elastin in other areas. Basically, when the lips get elongated, that's from losing collagen and elastin. Like I said, we lose it everywhere.
Right.
So that's basically, the heat will also tighten that area. Like I said, for that area, I actually put local anesthesia. It numbs the area, and I treat the area, and it helps it gives more sensitivity to that area, because after you have so many babies,